Ma'am? Yes. Are you able to call the anesthesiologist?
Someone is coming to take you to labor and delivery.
In a video that has now been viewed by millions, a pregnant Texas mother sits in a wheelchair crying out in pain. Her contractions are strong. Her body is telling everyone in that hospital that this baby is coming. And yet, behind the desk, the nurse continues asking intake questions as if this woman is not clearly in active labor. This moment struck a nerve across the nation. Viewers began calling the hospital. TikTok creators reported the nurse had been fired, though later proved that to be incorrect. That was false information. She was placed on leave as the hospital investigated what happened. The mother later assured everyone that she and her baby was okay. She delivered just minutes after finally being taken to a room. But this story is much bigger than one hospital and much bigger than one video. Black women recognize what they saw, the dismissal, the disbelief, the delay, because many of us, this isn't shocking, it's familiar. In 2022, black women faced a maternal mortality rate more than double that of white women. A national study found we are also more likely to undergo unnecessary C-sections, putting us at a greater risk of complication. And far beyond the numbers are the personal stories, like mine. Stories of calling out in pain after surgery, ignored for hours. Stories of being laughed at, brushed aside, or told to manage alone after major procedures. Stories of surviving childbirth but never forgetting how we were treated. We were raised to trust doctors, to believe in the oath, to believe in the professionalism. But too many of us have learned that racism and bias walk the halls of these hospitals right along the staff. This video didn't go viral because the moment was rare. It went viral because it was recognizable. Now our community is asking the difficult questions, demanding accountability, and fighting for change in the very places where our lives should be protected. Because every mother deserves to be believed, every mother deserves to be cared for, and every black woman deserves to live through childbirth.
Fuck! When's your due date?
Whatever you're doing right now, I need you to stop and watch this video.
Fuck! When's your due date?
Right now!
So you don't have to be an OBGYN. You don't have to have any medical knowledge to know that this woman is in distress.
Is your due date 11?
For those primal screams, not to invoke an ounce of humanity. Think about that.
What? How many times have you been pregnant?
Seriously, who gives a fuck? A baby's coming.
3!
This is your third pregnancy?
Yes!
You have 2 babies
It's
at
in
home?
my ass!
Third baby, it's in my ass, means she's gonna have a baby on the floor unless she gets that woman to a room now.
You have 2 babies at home? Who's your doctor?
Lang is her doctor.
Let's talk about this Dallas video because it's not just bad behavior, it's dangerous, it's discriminatory, and it's why black women in this country keep dying. The young woman's in active labor, and clinically we all know that priorities shift. Intake stops, and your eyes should be on that mom and the baby. But instead, we're watching a nurse sit there asking frivolous questions while a black woman is clearly in distress, progressing, and not treated with the urgency and dignity that she deserves. It's not just rude, it's dangerous. It's egregious, and it's actually disgusting medical care. And I need y'all to understand something, that as a black OBGYN, this is not an isolated incident. This is a culture. And this is what happens when a healthcare system that is not designed for anyone outside the majority, this is how it affects and shapes the legacy and how black women are treated in real time. This is our maternal mortality numbers. This is how black women end up ignored, undiagnosed, untreated, and unprotected. It's a bias, it's systematic, and it's behavior like this that gets passed down, normalized, excused. This is a culture problem in Dallas, Texas probably as a whole. And a culture doesn't change with a press release. It changes with accountability, retraining, leadership, consequences, and a refusal to let people like this touch patients. So, in closing, Black women deserve urgency, compassion, and clinical excellence. This ain't it. What we saw was unacceptable, and it's time that the healthcare system finally stops pretending that this doesn't happen. You need to do better.
There's a video going viral right now about a Black mother in labor, doubled over in pain, begging for help, while hospital staff ask her routine triage questions. I won't play the whole thing because I don't like amplifying Black trauma, but here's a clip that highlights what I want to talk about today.
Right now.
Y'all treat all your patients like this or just the Black ones?
She gave birth 12 minutes after that moment. My name's Dr. Joel, the Medical Mythbuster, and today let's talk about Black women and pain. Because as shocking as that looks, this didn't come out of nowhere. Moments like that are connected to a much longer story in American medicine. I want to start that story in the 1800s with J. Marion Sims, often called the father of modern gynecology. He conducted studies on enslaved Black women without any anesthesia, justified it by saying that Black women didn't feel pain in the same way as others. That lie didn't stay in the 1800s. It became embedded in medical and general culture, spreading through textbooks, training, and systems. Versions of that myth still show up today. For example, a study in 2016 from the University of Virginia found that at least 50% of medical trainees believed at least one false statement about biological differences in Black patients, including the idea that Black people have thicker skin or feel less pain. And that's how bias works. It doesn't always show up as hatred or slurs. It shows up as delays, as disbelief, as assuming that someone is exaggerating, as telling a woman in active labor to just answer a few more questions. When she asks, "Do you treat all your patients like this or just the Black ones?" she's not imagining things. She's naming a pattern that's been documented for decades. This is part of the reason why Black women in the United States are 3 to 4 times more likely to die during childbirth compared to white women. Not because of biology, but because of systemic bias and delays in care. For me, this isn't about blaming one nurse in one moment. It's about understanding how the systems we built and the history that we inherited make moments like this feel normal when they're anything but. We can't fix what we refuse to see. And Black women deserve a healthcare system that listens the first time.
The thing that's going to be really uncomfortable is that nurse did that on purpose. That nurse was behaving that way to that Black woman on purpose. That woman enjoyed the opportunity to display her racism, to display power and control over. That woman, that triage nurse from Dallas Regional Medical Center in the emergency department room, did that to that woman on purpose because she is racist. It was a conscious choice to deny care, compassion, humility, grace, kindness. That was intentional. When you watch the video and you hear her tone, you'll be like, that was 100% intentional. We are dangerous to Black women and Black families because we carry with us so much internalized allegiance to our whiteness and patriarchy that we will exact harm, actual physical harm on somebody because it makes us feel like we are closer to a food chain and a system of power that was never made for us. We will punch down. We will kick down. We don't challenge the authority at the top. We're not challenging patriarchy. We are exacting revenge and power over someone that we think, oh, finally somebody that has less than us. And you wonder why Black women say we are the men of women and they pick a bear over us, or being trapped in a boardroom with a white man. That nurse's disdain and coldness mirrored the pastor that we saw a week ago, right? The one who said, no, I don't even have a parking spot for you. And then went on to church to talk about the grace of God's love. We have a real problem amongst us, white women. And it is not going to get better unless we, as white women, start unpacking our internalized biases and also holding other white women accountable for their behavior and the environments that they create. I hope that that woman who was subjected to that kind of treatment both sues the hospital and wins, but also has some support and therapy to help her recover from an awful experience while she was in labor, which should have been a beautiful, supportive, and positive experience.
What exactly did you catch when you were watching that viral video of a woman 12 minutes out from giving birth dealing with this redheaded nurse? Did it remind you of your mother-in-law? Did it remind you about being a fancy black person, maybe shopping for something, having an accent in the wrong place? Do you think you can spot when someone checks their social status against yours? Let's process it and the feeling of powerlessness and anger that you had watching that video together. So the now infamous Dallas Regional Medical Center, a young black woman has come in because she is about to give birth. She's actively in labor. The nurse knows this. The universal medical standard of care is that this woman would have been rushed to labor and delivery where she could be monitored. Whatever extra details that they needed to get could have been taken from the person who was accompanying her along the way. This mother in particular had apparently already sent her information ahead. She had established care at this hospital. Here she is, wailing in pain, going nowhere as the nurse stalls. There was zero sense of urgency, and there was absolutely no patient assurance. The nurse keeps mother and baby in the intake room. Now, we could say nurses are used to pain. They've seen hundreds of births. They're not going to freak out, as one might say. But we're not talking about freaking out here. We're talking about someone who knows that the person in front of them has not lived through hundreds of births and who is in pain and in need of medical attention. The nurse is very aware that this woman is frightened and in pain and is about to do one of the hardest things any human being can ever do. And she shows, literally no exaggeration, you could go watch the video, zero empathy or concern or any reaction to the black lady's pain. And what this medical professional is aware of with every minute that she waits is that she's putting the mother and baby at risk of something being missed. She's keeping this woman from the chance to be monitored. She is slowing down and preventing the process for any pain relief or oversight to get in place. If there's an emergency happening, which she can't know in the intake room because, again, no one is monitoring her, these couple of seconds or minutes can be the difference between life or death for the mother and child. On top of the unnecessary delay, the lack of connection and concern being shown here is absolutely adding to the patient's stress, which is also stressing the baby that's about to be born. That stress on a person's nervous system has a weathering effect that can make them more likely to die. The family has reported back that the baby did have complications during and after the birth. The nurse failed to do her job, and she did it in the grand tradition of nurses using their position of power to status check people. This is one more link in the long chain of maternal health crises for Black and Indigenous women in America, not because of their class, not because of other comorbidities, not because of issues they've had with childbirth before, but because of medical negligence and racism. Lack of response is a form of weaponized negligence that looks at a Black woman and goes, she can take it, she's tough. We could also say we saw here malicious compliance, where somebody uses the cover of the process to delay having to service or care for you. They're policing you or punishing you for daring to even come here and ask for services and resources in the first place. People walk around with this idea of who they are and what their space looks like. And when you come into their space as a Black person or a fancy Black person or somebody who needs them to take care of them, there's a level of thinking that I'm too good to be taking care of this person. I am too good in this situation, this store, this shoe, this bag, whatever it is. It's too good for the people who are asking for these services. So I'm going to make it expensive for them to be here. So they use their jobs to covertly assert dominance. They argue, you can't buy this item at the listed price, you must be wrong. They move slowly and they intentionally do not give you the same customer service that they would give everybody else, or in this case, bedside manner. Well, maybe people are having a bad day or they're bad at their job. Here's how most people operate in a society. They are walking around with an internal story of who they are and who other people are. They also have a social hierarchy in their mind. We humans rely on a lot of visual shorthand to fill in ideas about what we're seeing in front of us or who we're seeing in front of us. Our internal hierarchy, that is developed over time by our culture, the people who raised us, the social circles we're in, or the media we consume. History is not just about events that took place, but the cultural memory that developed around them, the meaning and significance we have given to the things that have happened, and the norms we have normalized. You can thank Harriet Washington and her brilliant team for coming up with a comprehensive medical history of America. It's called Medical Apartheid. It explains how a place like the Dallas Regional Medical Center can hire someone like that and think that they don't have a problem. What we learn is that the entire birth and foundation for medical gynecology in America is through and because of enslaved Black female bodies. So many of the quick advancements in gynecology happened because you didn't need to ask for consent on women that you purchased and enslaved. You don't have to waste money on anesthesia or finding new people to keep testing this on because you can just keep testing on the same people you own. It wasn't just Black women. It was a way to continue to make money off of enslaved people who could no longer be squeezed for profit. So if you had someone who'd been injured because of your abusive work tactics, you could sell them for experimentation. This was normal. This is just like a really cruel, bad chapter in a tiny section of American medical history. No, it was its foundation. And it wasn't 4 years before the Civil War and just a couple years after. It was multiple generations. To this day, there are people and families that are bearing the scars of recent decades of medical experimentation and unethical access to Black bodies, people that were tricked. White bodies and white mothers were considered and classed as people who felt more pain and were much more delicate. To this day, there are young medical students right now running around with myths and assumptions and biases about Black skin thickness and pain reception. There are a lot of assumptions about what makes a Black person sick. And then we're also dealing with a situation where it's considered bad or woke to look at the interlocking factors that could affect why someone is in the situation that they're in, like ecological racism or pollution. The wider American culture at the time excused and hid this, and currently continues to excuse and hide this. Why do you think certain things are getting defunded? This is why, with the same money, same healthcare, same hospital, a Black woman could walk into the same situation as a white woman and be 3 times more likely to die giving birth. It's not about genetics, it's about negligence. This slow-moving, dismissive care is procedural violence. Additionally, because enslavement was the economic power engine that could make the American economy the superpower it was, it depended on producing more enslaved people, which meant taking away, and never giving, I should say, reproductive freedom to Black women. To keep it profitable and to keep it cheap, you weren't necessarily worried about the maternal health conditions. You weren't necessarily looking over all of the labor and delivery. This is a huge part of why bodily autonomy is not the state's default position towards women or Black women. It's simply not profitable. So you have this huge group of people that's stewing in old ideas and new recycled ones about how it's Black and brown people who are lazy and taking their resources. It's immigrants who are the reason why there's a housing crisis. There's an infestation of certain kinds of people. Do you think that when those women walk in to give birth, that people are going to necessarily treat them with respect and dignity? Tough and aggressive people who have too many kids, they're not going to get top care. Racism, long after it's used to be a social technology that produces a certain caste system, it becomes an internal form of narcissism, a way to stroke your ego. This white nurse was not going to be seen rushing to take care of a Black lady. Did that Black baby matter with the way she was acting? No. Did that lady's pain matter? Also no. She used, as many people have, her standing to check the other person. It was cruel, it was deliberate, and it was calculated. We tend to think that racist action, sexist action, people who are not welcoming you into their family, that they will announce it, that they will put on a hood, that they will say, I am saying a racist or mean thing, or you are less than me. We tend to think that unless they fully admit right there that I am doing this because I'm racist, that maybe it isn't. But it's not politically or socially expedient to telegraph status in a way that you could get caught. Because the point of this kind of behavior is not to be heard saying it. It is to get a certain outcome, to make you feel a certain way. How do we push back? We articulate what is happening to us. Because like James Baldwin said, once we articulate the situation, we're no longer the victim. We're a threat to that system. We support each other with doulas, birth funds, and looking for ways to fund community scholarships. We do what this grandmother did, which is film and share the story. Nurses at the Dallas Regional Medical Center and beyond might continue to see Black women as pests and problems. We know, like Lucy, Betsy, and Anakra, who are memorialized here, that Black women's bodies were the sites of so many solutions. That this profession owes so much to the unimaginable horror and pain that those women endured. People who are watching their research be rolled back, people who have lost their mothers and their wives and their sisters and just human beings to this crisis know that there's no real moving on from this. But there is moving forward with an awareness of what came before us. What increased digital power we now have to call this out and hold people accountable. The ways we can come together to spot and articulate this behavior in all the different ways it occurs and call it what it is. To the Dallas Regional Medical Center, you have a nurse that is too dangerous to be around Black women. To the rest of us, get Harriet Washington's book and don't be afraid to stay woke. It could literally save your life.
My father lost his mother at 16 years old due to medical malpractice while she was pregnant with a set of twins. She walked into a hospital and never returned home to her children. When I saw the video of this white nurse ignoring the pain of this woman that is clearly in labor, in active labor, I was absolutely disgusted. Not only was that sister's information already in the system because she was due to be induced that day, but this nurse, who people have identified as LaCrista Vaughn, nonchalantly handled this woman during this emergency, to which she literally delivered her son 12 minutes after. And for those who say that this is not about race, it is always about race, especially when it comes to Black people and especially when it comes to Black women in the medical system. The maternal mortality for Black women is 10 times higher than any other demographic in the United States of America. There are still racial biases that assumes that Black people can handle a higher threshold of pain to where we are not tended to, nor giving the proper care or medication to mitigate that pain. This book by Harriet A. Washington called Medical Apartheid literally details the history of medical experimentation on Black Americans in the United States. And also talk about how a lot of gynecological practices and advancements were as a result of testing Black women's bodies without medication or anesthesia. For me, it is not enough that LaCrista Vaughn loses her job. But white folks, it is time for y'all to stand up and stand within the gaps, because Black folks have been yelling into the void. It is evident that our screams, our cries, our hurt goes unheard. Y'all have the opportunity to actually advocate and stand up against things that are blatantly wrong and racist. Do something.
Hey guys, I'm here with Mom and Baby Cash. They are doing well. He has a doctor's appointment tomorrow at the pediatric center. It's a lot of concerns. They taking tests on him. He still have to go through several other tests down the line because he was born with his eyes open, and due to the stress and trauma that occurred in the triage area, the baby had a bowel movement in Mom, and the fluids was green, and like I said, he born with his eyes open. So they are, taking all that in consideration as well. But he's eating well, sleeping well, looking good. And I was also reading a lot of the comments, and some of you under the impression it was twins. They are not twins. This is daughter with baby Cash, and this is other daughter with baby DJ. They are a month apart. DJ born 10/10 and KJ born 11/11. Thank you again for your support and your concerns, and we will most definitely keep you updated.
Wait right here with my boyfriend.
All right. You can go ahead and turn your phone off too, please.
I can record. I'm in the pub.
Now, this is the same lady, that red-haired lady. That is the same lady. Her name is LaCrista Vaughn, from the video that's floating around now that has been going viral of that African-American lady that was at Dallas Regional Medical Center that was in active labor. This is that same nurse. This video is from 2023, and the person went to the hospital to get medical attention because they were having seizures. The girlfriend decided to pull out the phone because she did not like the way that her boyfriend was being treated. And lo and behold, as you can see in the video, that rare hair bitch, her name is LaCrista Vaughn. If you look at the video, look at her face. Somebody took a screenshot of this video, and when I tell you the lady is truly evil, she is truly evil. Now, like I said, this video is from 2023. So Miss LaCrista, she been doing this for a while. Dallas Regional Medical Center has been under scrutiny for quite some time now. So this is nothing new. This is actually sad and sickening, bro.
I'm watching this clip of a Black mother, and I will show you this, in active labor at Dallas Regional Medical Hospital in Mesquite, Texas, and my stomach is in knots. She is screaming, she can't sit, she's doubled over in pain, Anyone with eyes can see she is in active labor, and instead of being taken straight to labor and delivery, she is stuck in that waiting room for over 30 minutes while someone registers her like she's checking in for a dental appointment. So here's the clip.
When's your due date? Right now. Is your due date 11? What?
How many times have you been pregnant?
3.
This is your third pregnancy?
Yes.
You have 2 babies
It's
at
in
home?
my ass.
You have 2 babies at home? Who's your doctor?
Lang is her doctor. Y'all treat all your patients like this or just the black ones?
Beverly, this is the first patient for you. Alright, last name is Jones. She's G3P2. I'm not sure when her due date is.
Her due
I
date is
just
the
said it
10th.
was the 10th.
I think her due date is the 10th.
She got 3 pregnancies, 2 babies at home. I bet y'all listen next time. When you found out you was delivering at this hospital, your ass should have changed doctors. Everybody say how they treat people here.
And the healthcare professional sitting right there doesn't acknowledge her pain at all. No urgency, no assistance, no call to labor and delivery, nothing. 12 minutes later, she delivered her baby. 12 minutes. So that tells you everything and exactly how close she was when she was left out there in agony. People love to pretend medical racism is some historical artifact, but this is exactly what it looks like today. This is how Black mothers die. Our pain is dismissed, our symptoms are minimized, care is delayed until it's almost too late, and then everyone acts shocked at the maternal mortality statistics. There is absolutely no universe where this is acceptable patient care. Active labor at that stage is an emergency. She should have been immediately transferred to labor and delivery, full stop. And if this is how she was treated before delivery, imagine how she may have been treated postpartum. And that is truly what scares me. I hope that this young lady and her baby are safe, but this cannot keep happening. Black mothers deserve better, and the system knows it. It is long past time to root this out entirely.
White women go into these positions of direct service to intentionally harm, like nursing, social work, teaching. We were having a conversation, I think Black Girls started. We were having a conversation like maybe last year or the year before, and we were talking about how, I can't remember what the position was. Oh, white women in HR, how they are to Black women what the police are to Black men. And I remember adding to that conversation that also, you know, the same is true for nurses, for social workers, for teachers, like any of these positions where they're working with a vulnerable population. A lot of times they go into these positions so they can have power over someone and so they can be this harmful. This, like what we saw from that nurse in that hospital, is common practice. It's literally why so many Black women lose their lives in labor, in delivery, because of the behavior and like literally, I promise you, this is intentional. I worked in social services for decades, okay? I work with these women. They use these positions as an opportunity to punch down, to give them power. And that's why you will see so many women of no color in these positions being very harmful, especially to Black and brown people and children.
Although it was a stressful moment, shout out to that mom for filming her daughter being ignored by that nurse. Because when Black women try to get on here and have an intersectional conversation and reach across and touch our other women in love and let them know the violence that they perpetuate towards us, that they pretend like they don't see, because now I'm seeing a lot of white nurses get on here and do the whole, oh, it was wrong, it was wrong, it was wrong. It was wrong, but do you do it? It was wrong, but when you see it at your workplace, do you call it out or do you look the other way? Because let's be real, in a lot of medical spaces, the reason why racism exists and y'all keep people out is because y'all doing a lot of nefarious and fucked up shit, and y'all don't want nobody up in here that's not going to stay on code with y'all culturally that will tell on y'all and get them license snatched. I remember a young black woman on here told a story about how she basically seen a nurse ignore somebody's pain to try to prove that she was faking it. So she ignored an order that the young lady had from the doctor, and she lost her job. And the black nurse reported her ass, and she lost her job, and she reported her to the nursing board. That's why y'all be trying to keep people out, because y'all know if y'all let motherfuckers in that have even a smidge of empathy, they're going to tell on you. And let me explain something to you, to the bystanders, to the people that don't say nothing, to the people that look the other way, the people that uncomfortably laugh but don't snitch on nobody or don't say nothing or don't advocate for the patient. Y'all just as bad as the person that's perpetuating the harm. She looked at that woman in pain. Even if there was nothing she could really do because she's not a labor and delivery nurse, you're in a hospital. There's nobody you could call to come help this lady that's in pain. You couldn't call and be like, hey, I'm entering a Jane Doe because she need to come upstairs. We will just do registration at the bedside like you do with any other fucking emergency. If somebody's sitting there bleeding out from a gunshot wound, you're going to be sitting there asking them, so when's your birthday? Bleeding out? Like, now y'all get to see it firsthand. Violence doesn't mean that you have to lay a hand on somebody. That woman was literally writhing in deep pain. You could probably hear her screams out in the hallway. And she didn't even turn and look at her, acknowledge her, comfort her. She looked at her, she said, I can't help you. That's the shit that we're talking about. Remember when we started getting all the police brutality on camera? Yeah. Start taking them fucking cameras out at that hospital, because it's time to start getting motherfuckers in 4K.